Okay, good evening. I'm Dr. Reiner, your host of the Independent Doctors of Pahrump, and this is a live show. And the phone number should pop up there on the bottom momentarily, 727-8750, for those of you who care to call in and discuss or ask any questions or topics that are filling your mind with question marks and things of that nature. It seems that we do have a lot of viewers out there. I get comments periodically when I see people in public or at the office. Next week, we plan on trying to have one of the participants in the dispensary, marijuana dispensary here on the show. We made an outreach to them last week. I got interviewed on the medical marijuana and its issues here in the state and in our county and in our town. I guess we have several grow houses producing marijuana. I even have some questions about the dispensary. I know there's one down in Las Vegas, and apparently there's one that's getting ready to open. And according to some individual in my office, they apparently were interviewing people this week to work there. So I'm sure it's right around the corner, literally, up there on Basin Street, and it should be opening pretty soon. And, you know, we talk about this subject quite often, and I really have no objection to people using medical marijuana. And then I think one of the discussions about the patients were, well, you know, will it interact? Will it help me with sleep? Will it help me with all these other things? And nobody's really done any controlled studies on marijuana. So and that's because it's not a federally approved medication. And so nobody's done, a controlled study where they've actually looked at that. And I knew they had Marinol and it's being produced, but I don't think anybody's ever done a controlled study where they compared Marinol to a particular other subject. And of course, the Marinol being orally is going to be different than all of the other products that come from some of the marijuana plants. So it's pretty an individual response to marijuana, and those are the things that you basically have to pretty much experiment with it to see how it's going to interact with you and how you're going to react to that particular thing. But we all know that marijuana does have some, adverse effects on reproduction and some other things. But as far as its overall effect, it appears to be very helpful for people with chronic pain. And certainly the opioid issue is not going away. I have patients coming in all the time lately complaining that their pharmacies are out of the hydrocodone 10 milligram tablets. They're even out of the 7.5s, and they're getting no oxycodone. And this is, to me, is a really, really, again, a major issue for the community as well as every patient who might ever need to take a pain medication in the future. And I believe that this is getting to the point where the pharmacies are limiting the amount of medication that they're taking in. And I really don't understand that. I really don't understand why they're doing that. Or let me put it this way. I do understand why they're doing that. They have self-inflicted or controls that they've placed on themselves because they're afraid of the DEA and the fact that the DEA has been punitive to a couple of pharmacies and retail wholesale houses. And that's because of the amount of opioid going through those particular houses. So they just basically limit each pharmacy to the amount that they get. And that pays no attention to the individual needs of the community. Now, if you are a patient and you're watching this show and you've been affected by this, meaning going to the pharmacy and they tell you, oh, I'm sorry, I don't have any hydrocodone in stock and I don't know where I'm going to get it, my advice to you is to complain to the pharmacy board and complain loudly and often. Really, the DEA's main function is diversion, and their job is to make sure that the medication or the registered product is being delivered to the people in a manner which is fitting with medical purposes. And as long as that's being fulfilled, nobody has a complaint. Nobody can complain. I mean, they're not going to complain at all. And so it's really about the pharmacies, and there are articles on it on the internet all over the place talking about the DEA telling the pharmacies, know your customer. Now, if you've been going to Smith's for a year, filling your products, wouldn't you think that they would know who you are and who your doctor is and the reason that you're taking those prescriptions? But yet they still need to call. Walmart says we have to call and verify every prescription. Well, where does that come from? Does that come from the DEA? No, it does not. It comes from the pharmacy making sure that they know their customer. Well, there again, if they know you and you've been going there for a year, don't you think that they know you? Why do they do that? This causes patients undue delay in getting their prescription. Suppose they ran out the day before. Maybe they took 1 extra pill or 2 extra pills and they ran out. Now they need to get their prescription filled on a day where they're low on their medication. And is that the patient's fault? No, it's just a natural history of their pain. And when they're in pain, they need to take a few extra pills. When they're not in pain, they don't take a few extra pills. And this is 95% of the people. And certainly we do have people out there that are diverting their medication, but it has been my experience over years and years and years that if you are abusing your medication, and remember I've defined abuse as doing something despite the negative consequence of the action, meaning you're not taking it as directed on a regular basis, you're getting your pills by ill-gotten means, or you're doing something else that's deviant with your medication, that's an addiction. And eventually it will come out, meaning there's nobody who has an addiction problem that doesn't eventually cross an imaginary line in the sand where it affects what they're doing. That's just the nature of the beast. And so those people they surface. They turn in a negative urine screen when they're tested. They go to a different doctor and get a new prescription. So these are things that happen, or they get in trouble for selling their prescription. These are things that happen all the time. And eventually it comes to the forefront. I'm not the DEA. I just need to make sure that you have a legitimate purpose for your medication and that I'm exercising some due diligence in making sure that the medication is doing what you're doing and it has a prescribed method, that we've tried alternative methods, that things do work for you and they're working not against you. And when we have a problem, we put the brakes on and we slow down. That's just practicing medicine with reasonable skill and safety and not trying to worry about who's looking over my shoulder. If I practiced medicine worrying about who was looking over my shoulder, I wouldn't get anything done during the day because everybody at a time can scrutinize everything you're doing. But what I'm really trying to say here is that you as a patient should be calling the pharmacy board and complaining, because these are measures that are affecting your ability to control your pain, meaning that the doctor and the patient have the ultimate say-so. The pharmacy is really a facilitating avenue. They can't question you and what you're taking it for. They don't have that ability, that knowledge. We have Ray that called in. Ray.
Yeah, Doc, it's good to see you live on the air, and you're on such a roll, I was reluctant to call in because you're really hitting on target tonight. You really are. As far as the marijuana part, what they're saying, like Ohio is supposed to vote on it tomorrow to legalize marijuana, both for medicinal use and for what they call recreational. Recreational use is the wrong term. What they should say is decriminalize it. They're putting people in cages, for Pete's sake, for having small amounts of grass, and these people are serving time, and it's completely absurd. They have no idea of the positive consequences. I like when you use the term negative consequences on some matters or whatever. Mm-hmm. But this Sanjay Gupta has put out report after report of the positive consequences of the use of marijuana, whether it be through smoking or eating it or topical.
Right.
All these things are not pointed out. They make you seem like if you support any kind of marijuana, you're some kind of demon, and that's not the case. this is something that has to be looked into. And you pointed out on your show many times that the Fed's never going to do it. It's, it's against the law for the Feds. They're not going to do any research. So it's got to be more or less anecdotal, and people have to pick up on it and find out what works for them.
Mm-hmm.
So I applaud you on what you do in this first segment of the show. I actually had a couple of questions about measles and COPD, but what you're doing is perfect, and I'm not going to try to interrupt you anymore on that. But thank you so much.
We're gonna go to break here in about a few minutes, and then so call me right after the break, because those questions are good too, and you often spark a conversation, and I will remember that. So when we come back from the commercial break, make sure you call back in, because COPD is a great topic, and measles is another interesting topic. I don't know what your questions are, but I'll answer them to the best of my ability. But just
all right, I'll call in a little later then.
Yeah, just call a little later, because I always like your questions. You ask very intelligent questions, so I appreciate that.
All right, thank you, sir.
Okay, so I'll talk to you in a minute, and we're going to be going to break here just in a little bit, and then I'll continue my little discussion, and I think that but calling the State Board of Pharmacy. Remember, these boards, medical board, dental board, nursing board, they have to investigate every complaint. So yes, you overwhelm them, but if a pharmacy is getting enough complaints, they eventually will back off, and the pendulum has swung really far to this control side, and it needs to swing back to the other side. And like I said, the DEA, when they find Walgreens and they find Cardinal Pharmacy, they did it because that's their job. Meaning, if you had a 300% increase in your oxycodone prescription over a certain period of time, you should wake up and smell the coffee. Anyway, with that topic, I will continue that thought when I come back, and thank you for tuning in tonight. This is Dr. Reiner. We'll be back in a minute. Hi, I'm Dr. Michael Reiner, your host of the Independent Doctors of Pahrump, a TV show that airs Monday night on Channel 46. I want to remind you that I am a practicing physician in Pahrump, and I'm an independent practitioner, which means I am not bought by any insurance company or corporate medicine. We provide the highest level of care. We have nurse practitioners. We have other physicians, specialists who come to our office. Please come visit me. I'm at 1316 East Calvada here in the heart of Pahrump. Thank you.